what it takes to be a health professional and succeed in practice. So I'm going to switch to the next slide, and the key concepts that I want to talk about today for financial management is cash flow. Cash flow is very important. So when you're in a practice and you're trying to improve your practice, when you're in practice and you're trying to improve your practice and do better with your finances, cash flow is probably one of the top things that you need to pay attention to. And it's something we're not taught. We're just not educated on cash flow, and what does that exactly mean? So cash flow is the money coming into the practice and then the money you're spending that's going out. And there's two types of expenses that we should talk about today. One is fixed expenses, so expenses that you've committed to, whether it's rent or some equipment cost, they're going to stay the same over the next year to 5 years. And then we want to talk about variable costs, and this is where we can really make a big difference, is the variable costs, or some of the subscriptions we have, discretionary spending. Those are areas that we really want to think about and budget going forward. So that could involve advertising on Google Ads or Facebook ads. It could involve the programs and the incentives you're running in your clinic, even the supplies that you're ordering. There's a number of different categories we can look at for that, but that does affect cash flow, because when your costs keep rising, and especially today with inflation being where it's at, I think sometimes it can be hard to keep up if you don't have a firm grip on what's happening. At least monthly you should be checking your cash flow and your financial statements, but I like to keep an eye on things on a weekly basis just to see how we're doing, what are the statistics like, what kind of revenues are coming into the practice, and what kind of expenses are going out, and to budget for those, make sure that I know what time of the month those expenses are coming out, and is it worth it? You want to question yourself, are you getting the return on Google advertising? How much are you spending? How much is a new client worth? How many new clients are you getting from that Google advertising? So that's how I look at it, and we can dig deeper into that at a future masterclass. But today I just wanted to touch on these concepts with you. There's tools and software that can help you, and there's people that can help you with this as well. So a bookkeeper or an accountant can help you. Tools like software that can give you reports. You can use QuickBooks, let's say, to do your financial management, your expenses. You could use a spreadsheet to put everything on that spreadsheet. Bottom line is you need to understand your cash flow in the practice. You can ask other people for help, but I wouldn't solely rely on those people, because ultimately the buck stops with you for your practice. If you own the clinic or you own your own practice, you need to understand your own cash flow. Other things we can talk about here is budgeting and forecasting techniques. So breaking down the process of creating a realistic budget. You can kind of foreshadow, if you, I'll just use a number, if you did $500,000 in revenue last year, and you're growing and your growth rate is 10%, then this year, 550,000 is realistic. And how are you going to get there? Or how can you get to 600,000? And that's going to involve maybe boosting some of those variable expenses like Google ads or Facebook ads, just to get a bigger return, and testing that, testing to see if you spent a little more on Google ads, does that increase your new clients, and does that lead to more revenue? Can you get more referrals in the practice? And how can you do that? And what does that involve? So again, there's ways to improve your cash flow, ways to get more revenues, and to reduce or minimize expenses. And so setting up a budget is very important, using some tools and getting some expert advice, including a health coach. That's something that I do, is coach health professionals on how to improve their practice and how to improve their finances. It's always good to get an objective view, someone who's not directly related to the practice and someone who's got experience, because it shortens your learning curve and it speeds up the time for you to get to your goal, because you avoid some of the costly mistakes that you can make. Now, speaking of that, this slide talks about key performance indicators, or KPIs, for success. So what are the vital KPIs for health professionals? One is patient volume, average revenue per patient, overhead costs, so we can divide that per visit as well. So there's a number of different metrics we can use depending on the type of practice to get some indicators or measurements and start to focus on certain areas to improve them. You should be interpreting these KPIs so you understand them, and you should be focusing on some of the KPIs to improve your practice. For example, in my practice, there's several KPIs that are very good. I'm very happy with them, but there's other KPIs that need to improve. And so having a staff meeting talking about some of those other KPIs that could be better will just enhance the practice, make it a better practice. Now, you can't solely focus on those KPIs. I find clinics that get too focused, obsessed with certain KPIs, that can really lead to the wrong approach. So if you don't put the patient first, and if you're really focused on just the metrics, that's the wrong way. It's backwards. You want to make sure that you're really focused on the patient first, providing great care for the patient, and then improving some of the business metrics that surround the patient's visit and the patient's well-being. Now, strategies to enhance revenue. There are innovative methods that you can implement to increase practice revenue without compromising patient care. You can expand services and products that you offer in the clinic. You can optimize appointment scheduling and improve patient retention. And there's many tips on pricing strategies and managing supplier costs. I like to assess the supplier costs on a monthly basis. So where the supply is coming from, what's the volume of the supplies like? Can we renegotiate the volumes of the supplies we're ordering? And can we switch suppliers if need be to improve the bottom line? So there's a number of measurements we can use for that based on the products and the products we're ordering, the volume of the products, the sales from those products. So again, we want some metrics, and we want to be thinking about this to improve our practice. We also want to improve the quality of care in the clinic. So when we're changing some of the systems in our clinic, we just want to go slowly, one thing at a time, to improve the patient experience. We don't want to change too much at once, especially if we've already got a really good practice. We don't want to start disrupting things too much. On the other hand, if you're starting new, trying to implement some of these changes and looking at it like a bit of an experiment where you can test one procedure versus another is really good. So it depends on where you're at in your practice. If you're new, if you've been struggling for a bit, you're maybe 5 or 10 years out in practice, or maybe you're 10 or 20 years out and you just want to improve the efficiencies in the practice. That's very important too. Training is very important, and that's something that we offer here at True North, is training for doctors and therapists, training for clinics, the staff, talking about how we can work as a team. And I've always said 1 + 1 = 3 in the practice. So there should be a compounding effect to the work you're doing as a team. And for the staff, they just want to know exactly what you expect. It has to be very clear. Most staff want to achieve and exceed your expectations, but if there's a breakdown, it's just communication usually. It's just being really clear about the procedure, and also sharing the big picture, the vision of the practice. So sometimes we lose sight of, we're in the details or in the weeds, we're working really hard on a daily basis, but we forget to take a step back and go, why are we doing this? What's the big picture, the vision and the mission for the practice? And for most of us, that's to change and save lives. We want to change and save lives in our community. We want to make a difference. And if you're competitive, you might want to be the number one clinic in dentistry in your community. You might want to be the number one medical clinic, chiropractic clinic, a physiotherapy or physical therapist clinic. So there's a number of different metrics we can use and ways to achieve success and measure that success. We also want to manage stress and motivate our time during these periods of change. So we want to first foreshadow that changes are coming. We want to discuss why the changes are happening. We then want to give staff and even ourselves some flexibility to make these changes. There's going to be some mistakes, there's going to be some challenges, and we want to give ourselves that extra support one another, and also have that time away from the clinic to recharge and regenerate, to get some extra rest, and to get some extra help if needed. So that is what I wanted to talk about on this slide, strategies to enhance revenue. I'm going to go to the next slide. Implementing change without impacting patient care. So when patients come in and they expect a certain type of service from you, and they've come to you for a while, some of my patients have been coming for 5-10 years, you want to make sure that you keep things consistent. They depend on that from a health professional. That's why they come to see you. And there's a lot of trust that's built up between the doctor and the patient, the therapist and the patient. So when we're making changes in the clinic, we want to make those changes slowly. We want to explain to the patient why we're making these changes. We want to let them know it's to improve the practice, to make their experience a little bit better. So we definitely want to share that with our patients or our clients, and we want to make them partners in the practice and the success of the practice. So we want to explain that to patients when they come in for their visits. We want to share that in a newsletter when we send that out on a weekly or bi-weekly basis to our patients. And we want to get a survey from the patients on the patient experience. So we just want to find out more about how those changes are affecting the patient's experience at the practice. So we definitely want to find out from the patient or survey the patient, are the changes making a difference? So on this slide now, I wanted to find out if you had any questions. I'm just going to go into the chat here on YouTube. I'll be watching as well on Instagram Live, and just want to know if you have any questions. So, and if you do, please type them in the comments, or you can type them in the chat here on YouTube, and I'll be happy to answer those questions for you. If you're watching this at a later date, so if you're watching this, the recording of this, or you're watching a segment of it on our social media channels or our podcast, then feel free to DM me or to comment at that time. But right now, while we're live, I wanted to answer any questions you might have about the business side of a healthcare practice. I wanted to talk about a little bit more about cash flow and how to reinvest that money into your practice, and where should you put it. And I think as you're growing, and last year we grew considerably here in the clinic, you want to think about reinvesting that money back into the practice. So paying down debts is very important, but also you want to take that money, reinvest it into marketing, into equipment, into improving the practice, hiring extra staff to help you. Anything like that, which can get you to the next level, is very important. And sometimes you don't know what exactly you need to do, and I think that's where a coach can be very helpful because coaches understand, they've been there and done that. They understand, what needs to be done to improve the practice. And it's always great to have a coach or a mentor. Most of my career, I had a coach, a consultant, mentor, and that really helped me to improve my practice. And in the first 3 years of my career, I did locum. So I worked in different clinics taking over for chiropractors that were going on holidays or were injured or sick. And I got to see their practice from the inside out. So that was kind of my business school early in my career. And I carried a lot of those tips forward, and it gave me a lot of confidence to open my own practice. And since then, I've worked with many different health professionals with their practices and their careers. Of course, I've had my own practice for 25 years, not just in one location, but multiple locations. And I've had multiple staff working for me, administrative staff, other chiropractors, some therapists, naturopaths, massage therapists. So there's, in a multidisciplinary setting, you have to consider the different professionals and their needs. Some health professions have more products. Some health professionals have more services. So it's really, you want to gear your advice towards that particular health professional. But I want to see you guys prosper. I want to see young health professionals prosper in their careers. I don't want to see health professionals making costly mistakes or going bankrupt or being insolvent, especially after all those years of studying and some of the debts that you take on. You want to pay those debts down. You want to eventually own your own practice, and be in control of your own destiny. And you want to make some good decisions over time, because that's not only going to help you with your practice and your career, but it's going to help your family and your personal finances as well. So that's really important. If you have any questions, type them in the comments or here in the chat on YouTube. I've got a few more minutes to answer questions today. And then I'll be starting with my own patients here in about 10 minutes. So I've got about 3 or 4 more minutes to answer your questions. If you're interested in joining me in future webinars, you can go over to our Eventbrite page. So on the Eventbrite page for True North, you're going to see the upcoming webinars, and the next one's going to be May 8th, which is a Wednesday at 6:30 p.m. Pacific, 9:30 Eastern. And the topic of that webinar is going to be the art of retention. So we're going to be talking about keeping your patients engaged and satisfied. So that's kind of relating to one of my slides today of the patient experience. But we specifically want to talk about retention. Are patients coming back to your practice? Are they coming for their yearly cleaning if you're a dentist? Are they coming for their monthly checkup if you're a chiropractor? Are they using your services on a regular basis, or are they not coming back because the service and the experience wasn't that good? So we want to talk about that and what metrics we can use to measure that at this webinar. And so that's going to be on Wednesday, May 8th. If you're interested in True North and my coaching services, you want to get on our email list, go to trueexpert.pro. So trueexpert.pro, and you can see the different services we have to offer there to health professionals. You can get on our mailing list. Also, you can sign up for a free 15-minute coaching call. So we're offering those right now. Feel free to go to the website to sign up for that. Follow me on social media as well. We're on Instagram, TikTok, Facebook, and X. So you can follow us there, and LinkedIn as well. And here on YouTube, follow our channel. We're always posting videos and the blog posts. So you can go to our blog posts and see, we're doing blogs on a daily basis, and those blogs are on the next webinar topic. So on retention, we'll be talking this week and next week each day with our blog on retention, and I'll be doing short videos and audio on that. And then we have our podcast channel that's on Spotify, Google, and it's on Apple iTunes as well. So thank you for joining me today. I hope you guys learned something about finances and how to be better stewards of the business side of your practice. And I hope to see you guys on May 8th. Please sign up for our newsletter, our email newsletter, by going to the website, and I will talk to you guys soon.